And thank you to everyone for joining us today. Before we get into today's topic, I want to start by mentioning that this webinar is sponsored by the Public Health Law Center's Tobacco Control Legal Consortium in St. Paul, Minnesota. We are a national network of attorneys that support tobacco control policy change at the local, state, and national levels. We do this in collaboration with legal centers in other states by providing free legal technical assistance to public health organizations, community leaders, and a whole host of other individuals and organizations. Our support includes helping to write policies, analyze laws, and we also provide educational resources and trainings such as this webinar today. And I'm pleased to be moderating today's webinar. As Cam mentioned, my name is Darlene Fong, and I am a staff attorney here at the Public Health Law Center. We have three terrific speakers lined up, and I will introduce each of them in just a minute, but I first want to give everyone an idea of what we'll be covering today. So as you all know, this webinar will be a great discussion about HUD's proposed rule to restrict smoking in public housing. I will provide some context about the smoke-free housing movement, and then we'll have a representative from HUD give an overview of the rule. Next, we'll have a smoke-free housing advocate who's been doing the on-the-ground work, talk about policy implementation, and lastly, my colleague will explain how to submit comments about the rule and what types of information you could include in your comments. And then when we get to the end, I will pose the questions that you've submitted to our presenters, and we'll get through as many of those as we can. So the smoke-free housing movement is really part of a larger clean air movement that over the years has done a really phenomenal job educating the public about the health consequences of secondhand smoke. This is an image of the Surgeon General's report, which definitively concluded there is no safe level of exposure to tobacco smoke. Even the seemingly small amounts that can drift between units can be harmful to people's health. And as people have gotten used to more and more smoke-free public places and work environments, they are demanding and expecting smoke-free environments at home, too. The public health benefit has, of course, been one of the pillars of the smoke-free housing movement, that smoke-free policies are the only way to eliminate exposure to the toxic smoke transferred between units. But smoke-free policies aren't only good for health, they're good for business in a number of different ways, too, like reducing turnover costs of smoky units. And the third major pillar of the movement has emphasized that smoke-free policies can reduce legal liabilities from exposure to secondhand smoke and are entirely legal to adopt. So those three pillars have resulted in smoke-free housing policies across the nation in both market rate rentals and affordable housing properties. And since we're focusing today on public housing, I pulled this map from the American for Non-Smokers' Rights, which shows the different parts of the country with smoke-free public housing policies. Just 10 to 15 years ago, this map probably would have only had a dot here and there, but we've come a long way thanks to many of your efforts. And to put this into actual numbers for everyone, this is a screenshot of a HUD smoke-free public housing page on the left-hand side there that has a link to a list of public housing authorities that have a smoke-free policy. If you click on the link circled in red on the left, this Excel sheet on the right opens up, and you can see that HUD is aware of over 600 public housing authorities that have a smoke-free policy for either some or all of their properties. And that's an amazing accomplishment in a relatively short amount of time. So with that context, I want to introduce each of our fantastic speakers today. Tara, Kara, and Mike will each provide some really helpful information for better understanding HUD's proposed rule and how to implement smoke-free housing policies and how to submit comments about the rule. So our first speaker will be Tara Radicevich. Tara is a special assistant in the Office of the Assistant Secretary for Public and Indian Housing at HUD. She has over 13 years of service to HUD and has served in a few different roles there, including as the Public Housing Division Director in the Minnesota HUD office. Tara also previously worked at the National Center for Healthy Housing, where she coordinated trainings and supported grants with the CDC and EPA. She's also very proud of her work at the White House Council on Environmental Quality in the summer of 2010 on the Children's Environmental Health Task Force and to help coordinate environmental review issues related to the BP oil spill. Thank you, Tara, for being with us today. Our second speaker will be Kara Skayen, who is Program Director for the Live Smoke-Free program at the Association for Non-Smokers Minnesota. Since 2007, Live Smoke-Free has been providing educational resources and technical support to building owners, managers, local policymakers, and residents of multi-unit housing throughout Minnesota. Live Smoke-Free also provides technical assistance to smoke-free housing advocates at the state and national levels. Kara has given numerous presentations on smoke-free housing at the local, state, and national level. She has also provided one-on-one assistance to property managers, owners, and residents of public and private rental communities since 2011. Our thanks to Kara as well for joining us today. I'm also happy to introduce my colleague, Mike Freiberg, who will speak last. Mike is a staff attorney with the Tobacco Control Legal Consortium, where he provides legal technical assistance to communities around the country working on smoke-free housing and other tobacco control policies. Mike also served as a Minnesota State Representative and spent 9 years on the Golden Valley City Council helping to craft the city's strong secondhand smoke ordinance that was adopted in 2004. He has taught classes in legislation and public health law as an adjunct law professor, and previously worked for a member of Congress as a legislative assistant specializing in health care. So without any further ado, let me turn it over to Tara to give us an overview of the proposed rule.
Thanks, Darlene. Thank you also, Mike, for organizing this call today, and more broadly to the Public Health Law Center for their many years of work on the legal issues related to smoke-free housing. I saw that Warren Ortlund is also on the line, and I wanted to especially give him credit and thanks for his many years of support of HUD's efforts around smoke-free housing. And with that, I'll jump in here. So this rule, let me advance my slides here. So our proposed rule comes after many years of work here within HUD. We issued our first policy notice to public housing providers in 2009. There was a complementary notice to multifamily or project-based Section 8 owners from the Office of Housing around that time. We also had a request for information published in the Federal Register in 2012, and we accepted comments on that. After that, you know, we stalled a bit, and then I need to give credit here to Secretary Julian Castro and also our Principal Deputy Assistant Secretary Lourdes Castro Ramirez for pushing us again to get a proposed rule developed. They have both been personally invested in this rulemaking and continue to be engaged, and their involvement has ensured that we've been able to get the proposed rule published and moving. You'll see we published it on November 17th on regulations.gov. Our rulemaking docket is essentially a live portal where you can see comments as they are getting posted from the public. That is the link there, and we could probably get this out after the event if folks don't have it. You can also link directly to it from HUD.gov. If you go to HUD.gov, you can see one of our graphics supporting the rule. If you click on that, it takes you right to the rulemaking docket so that you can submit comments. So the basic requirements of the rule, I won't read this to you, but I want to make sure I hit everything. We're proposing to ban lit tobacco products in all indoor areas. It would also include the administrative buildings of the Public Housing Authority, common areas, and a buffer about 25 feet around the buildings. It would apply to all housing types, including single family. So for this, many of our housing authorities, we have the high rises that you expect to see in public housing, but we also have what we call our scattered site units, where we have single families, some duplexes, triplexes, et cetera, that would also be covered by this rule. The most compelling reasons for this rule, obviously, we know that the benefits to residents and staff are going to be significant, but also the reduced fire risk and the lower maintenance costs. The fire and the maintenance costs were probably the reasons that the Office of Public and Indian Housing we were most concerned about making sure that this rule moved forward because it's going to offer significant savings. We heard from many housing authorities in advance of the rule that said they were considering going smoke-free. They weren't quite able to get their boards to agree to it, but once they had a catastrophic fire, the decision made itself. And with smoking-related fires, we see a higher incidence of death as well. So these were really tragic events that compelled them to go smoke-free. As I mentioned, there would be an extension up to 25 feet from the buildings. And then we put a lot of, we wanted to allow flexibility within the rule for housing authorities to go further than that. So that would include maybe they could make a playground, an area that's, even if it's outside of the 25 feet, that playground could be smoke-free. They could consider a campus-wide ban. So for public housing, generally the work that we do in public housing authorities, they're around publicly developed policies that are approved by the board, and they are developed with resident participation. So we put in the rule to add this into their annual planning because that already includes resident engagement in public meetings. These public meetings are usually monthly when the Board of Commissioners meet. The Board of Commissioners also includes a resident member, at least one. The prohibition, though, would be put into the tenant's leases. So it wouldn't just be that you have to follow the policy and not smoke. It's part of your lease, and making it part of your lease could mean that enforcement could include termination of the lease. We're proposing that the rule would be fully effective for housing authorities at least 18 months after publication of the final rule. So remember, we are just in the proposed rule phase. This is an element that's open for comment, the 18 months. We wanted to make sure we allowed housing authorities time. It takes a significant amount of time to develop a new policy, engage the residents, have the board approve it, but then also it takes more time as well to do the lease renewals. And allowing 18 months would give housing authorities time to do that lease renewal as the leases come up. The proposed rule does not cover public housing units in mixed finance developments and any sort of privately owned but subsidized multifamily housing. So this is, these are our project-based Section 8 properties. These are properties that are managed by the Office of Housing. We're asking for a lot of comments in the proposed rule. So first I should say that the proposed rule is open for all comments. We accept all feedback and comments from the public on our rule. But we had some specific questions that we posed where we knew we had to gather more information, specifically around the implementation barriers and the cost of enforcement. So in this area, we know that our housing authorities are already engaged in developing policies, meeting with residents, finalizing policies, and doing regular lease renewals and lease enforcement. But what we didn't quite have for this rule is solid information on their cost of implementation. We have some scattered reports of the costs related to signage, administrative time, but we would like to get some more information about that. We wanted to know if this rule goes far enough. We know that there are adverse effects on residents. We know that there are particular effects on children and persons with respiratory ailments or COPD, but we wanted to know, does this rule go far enough, and are there areas that should be considered? We wanted to know about burdens to specific families and persons with disabilities. This is an area of particular concern for us because we know in public housing that we have a lot of residents with physical disabilities, we have residents with mental health disabilities, and is this rule going to impact them differently, and how will our housing authorities work with those families and consider their additional special needs? We also wanted to know the impact of eviction. So where we already have housing authorities implementing smoke-free policies, we know that ultimately many of these policies will result in lease termination if the resident does not comply with the policy. We don't yet really have a sense for all of these policies and how many evictions have resulted from smoke-free policies. We want to gather more information on that. Where we have, again, housing authorities that have already gone smoke-free, what exceptions have been granted, what are the best practices around implementation or enforcement, and then whether the housing authority offered cessation services to the residents, and did they work with outside groups. So one challenge with our public housing authorities is that in many areas, our housing authorities they're really landlords, but they do serve, they're landlords first, but they serve a special sort of clientele, and especially where there are persons with disabilities or special needs, they may partner with service providers, but we didn't have good information on where this was occurring. I should say, though, that a lot of the information that we have collected from our housing authorities are compiled. It's in a guidebook called Changes in the Air that's on the HUD website. If you go to www.hud.gov/changesintheair, it's a guidebook, came out in 2014, that bundles up everything we do know to date. And what we do know to date is the better you do your implementation, the easier it is to do enforcement, the easier it is to implement your policy. We do know that where housing authorities have partnered with local organizations to offer cessation services, that helped assist their residents, especially those that were very long-term smokers, comply with the policy. But again, we need more information, and this is where we hope to see a lot of comments from housing authorities and other persons that have implemented these requirements. Some more comments and areas that we're seeking comment. Where can HUD be most helpful? Is there technical assistance that HUD should be providing to our housing authorities? What would that technical assistance look like? We have a few ideas on what we can do, but we need to hear, hopefully, from our housing authorities about what they need and their greatest needs. We also had a lot of we have a lot of questions around electronic nicotine delivery systems, ENDS. These are better known as electronic cigarettes. There is a very strong push within the public health community to include e-cigarettes in smoke-free policies. As the proposed rule is structured now, we strongly encourage our housing authorities to include e-cigarettes, but it is not required. Probably the most compelling reason why we did not include them is that we didn't see the same level of property damage with the e-cigarettes. While we are very concerned about the health of our residents and exposure to the chemicals emitted from electronic cigarettes, again, we didn't see the fire and the property damage, and those were the very compelling reasons for the smoke-free ban. But getting to that further on, we did not include water pipes or hookah pipes either. Those, though, they do have more of a, I think they light the coal, and so there could be some fire risk there, but we just didn't have sufficient research or studies to support including those in the proposed rule either. So at this time, those are both encouraged. These would be areas of flexibility for our housing authorities to decide at the local level. This is just a quick snapshot of our public housing residents. We know it's about 2 million, and we know that we have a high percentage of African American residents, Hispanic. We know we have a significant population of children. These were all things that we were looking at as we considered how this rule would impact the residents of our public housing. And then we know from the American Housing Survey in 2011, the few questions were added thanks to HUD's Office of Lead Hazard Control and Healthy Homes. They inserted some additional questions for residents related to their related to smoking and other demographics. And thanks to that data, we now see that at least 25% of our households are smoking, 25% of children, and then we do see, we do have residents that are in poor health. I think it's generally equivalent. I'm not the health expert. He could not be with us today. It's generally equivalent to other populations experiencing low socioeconomic conditions, but we do know that it is a significant issue within public housing and our residents. And as Darlene mentioned early at the beginning, we already know we have over, let's see, what, 612? I thought we were at 611. We already know we have over 600 agencies that have already adopted smoke-free policies in at least some of the properties they manage and how many units those are. We don't have an official reporting requirement. We do gather it as part of annual PHA planning, and then we work with our field offices where they're aware of agencies that are adopting smoke-free policies. Of that universe, we know we have many that only have partial smoke-free policies. So by partial smoke-free policy, we mean maybe they just cover a new to building or a building that's undergone significant renovation. Those agencies, they're going to be impacted by this rule almost as much as an agency that has no smoke-free policy. So we know that this rule will present an additional burden on them. So we are hoping to hear from agencies that have smoke-free, partial smoke-free policies as to what's next for them. There is no, I can say quickly, there's no provision to grandfather in existing smoke-free policies. The expectation is that as the proposed rule is written, if it is finalized as it's written, the expectation is that agencies with partial smoke-free policies would need to bring the policies up to the level of the federal requirements. And they have the same time frame as agencies that are starting from scratch. This is my email and phone number. I'm happy to entertain questions and requests for additional data after this presentation. Thank you. With this, though, I'm going to hand it over to Kara Skahan here with Live Smoke Free Minnesota. And Kara, if you're on the line, I will go ahead and mute.
Wonderful. Thanks so much, Tara, and thanks to the Public Health Law Center for organizing this important webinar. It's an honor to be a part of this conversation today. I want to begin briefly by outlining some of the many benefits, some of which you've already heard, of smoke-free housing policies. Smoke-free housing policies reduce smoking material-related fires, protect housing investments from property damage due to secondhand smoke, encourage people who smoke to reduce their consumption or quit. They save money for residents, property owners, and taxpayers. In fact, a recent study by the Centers for Disease Control and Prevention found that smoke-free subsidized housing would save $521 million a year in healthcare and housing-related costs. And most importantly, smoke-free housing policies promote equity by protecting vulnerable priority populations, like the elderly and the young, from harmful second and third-hand smoke exposure. Here at Live Smoke Free, we believe that everyone deserves a healthy, clean, and safe place to call home, regardless of income or housing situation. So what makes it for a good policy? The Tobacco Control Legal Consortium and HUD have excellent sample policies for you to use, but a few things to keep in mind. Make sure that the policy is written in a lease or house rules, that it clearly defines what constitutes as smoking. It addresses what areas of the property are covered by the policy and who the policy applies to. Make sure that it covers at least 100% of the indoors. As you also just heard, does not permanently grandfather smoking. And it is also helpful to include information on how the policy will be enforced and clearly define the consequences for violations. Prior to implementing a smoke-free policy, take some time to think about your current situation to help you plan and effectively roll out a policy. Some things to consider include, what is the current culture around smoking within the building among residents and staff? What rules, if any, currently exist to regulate smoking? And what benefits and challenges do you anticipate from adopting a new policy or expanding a current policy? Initially, it is also a good idea to conduct a scan of the smoke-free housing landscape in your own area. Consider if there are any colleagues that could share their insights and experiences with you. Also take time to review local smoke-free laws in your area, as well as any HUD recommendations or requirements that may impact what your policy entails. Lastly, I highly recommend that you seek out community partners for resources and support. There are hundreds of excellent smoke-free housing programs and public health organizations throughout the United States who are willing and able to assist you through the smoke-free process. I will discuss how to connect with these programs in a later slide. Proper preparation of both staff and residents is vital to a smooth policy implementation. Before a policy has gone into effect, you will want to engage both residents and staff in the planning process as much as possible. Resident surveys are beneficial tools for engaging residents as they provide an opportunity for residents to share feedback as well as provide information for management. Other beneficial activities for educating and engaging residents include resident meetings or presentations to the resident council. These meetings can discuss the harms of secondhand smoke, the benefits of a smoke-free policy to the community. They can address preliminary concerns and answer commonly asked questions. It is also helpful to begin discussing the smoke-free policy at staff meetings to educate staff on the benefits of smoke-free policies and effective talking points they can use with residents. During this preparation phase, you will also want to flesh out policy components, coverage area, and what enforcement will look like. Will your policy cover just the indoor areas? Will it include some outdoor areas or the whole property? What will the enforcement steps look like? It is recommended to add these details to the policy language for increased clarity for residents. When preparing for a policy, it is also helpful to work backwards from the effective date and create a timeline that identifies key activities and communications that need to occur before the policy goes into effect. Once the policy components and timeline are solidified, it may be necessary to seek board approval and undergo a public comment process. At this point, you will want to provide a formal written notice to residents, including the reasons for recommending the policy details, and time frame for the transition. Provide a contact to whom residents can direct questions and concerns during this period. Some managers find it helpful to also hold resident meetings at this point in time to answer questions that may arise and quell fears that may have arisen among residents. After the board has approved the policy, most public housing authorities will need to amend their annual plan to reflect the smoke-free policy language. At this point, you should also begin scheduling lease and house rule signings with residents. Most frequently, this will occur during their lease renewal or recertification process. Depending on the lease structure of the building, this process may occur either all at once or be phased in over time. If it is to be phased in over time, be clear with any new residents moving in that the property is transitioning to smoke-free, and provide the date the policy will be complete. Once all residents have signed the new policy, the policy will be in full effect. Prior to full on-site implementation, take time to prepare on-site staff and resident services. Ensure that all on-site staff are informed of the final policy details, talking points, and enforcement protocol. It may also be helpful to notify your local legal aid office of the policy change and reasons for implementation in case they are contacted by residents about the policy. Additionally, you will want to make cessation resources available to residents who may want to quit. Although quitting smoking is not a requirement to live in a smoke-free building, many residents will use a smoke-free policy as an excuse to quit smoking. Linkages to cessation can take many forms, including distributing promotional materials like flyers, door hangers, or brochures, or holding resident meetings specifically to discuss questions about cessation. I will discuss how to locate cessation resources near you in an upcoming slide. Additional implementation activities that are strongly recommended include installing permanent signage, distributing reminders, and holding an on-site celebration for residents. Smoke-free policies are largely self-enforcing, but it is vital to post permanent signage anywhere you don't want smoking to occur on the property. Signage serves as a reminder to residents, staff, and guests about the smoking rules, as well as takes the onus off of residents when they have guests visit. Check with your local public health department or smoke-free housing organization to see if free signage is available for your property. Consider also distributing reminders to residents both prior to and after a policy has taken effect. This can be accomplished via newsletters, flyers, door hangers, resident meetings, or distributing in-unit reminders like refrigerator magnets, keychains, or notepads. Once the policy is in full effect, many managers like to hold a small celebration or ceremony to mark the transition. Celebrations can be a great opportunity for continuing education about the policy, distributing cessation information, and setting a positive tone for moving forward. For a policy to be successful, it needs to be enforced. The most common complaints I receive from residents post-policy are those of management not following up with violations. To the best of the manager's ability, it is imperative to stay committed to the policy and enforcement protocol. Follow up with infractions promptly and uniformly, and if possible, enforce the policy the same as any other policy on the property. It is also helpful to encourage residents and all staff on site to notify management of infractions that they see. A few lessons we've learned over the years that help promote success include giving ample notice. Changing the cultural norms of smoking behavior within an apartment community is a process and can take some time. Provide residents enough time to help them prepare mentally and logistically for the policy change. Additionally, prepare everyone on the property as to the policy details and enforcement protocol. This includes residents, management, janitorial staff, social workers, caretakers, and anyone else who may be on the property. It is also important to focus on vulnerable populations. Partner with on-site social service providers to help proactively address resident needs and acknowledge resident concerns positively and compassionately. Keep in mind also culturally appropriate messaging. For example, I've been told that secondhand smoke can be interpreted to mean smoking with two hands when translated, and that smoke-free can be interpreted to mean giving away free smokes. Be sure to partner with community organizations who can provide cultural and social support for residents during the policy transition. As previously mentioned, it is important to provide linkages to free cessation resources to interested residents. Contact your local public health department, health clinic, or American Lung Association to see what resources might be available near you. You can also call 1-800-QUIT-NOW to be directed to the state or local resources in your area. If you'd like to learn more about the smoke-free policy adoption process or see what resources are available to help get you started, I encourage you to visit the Department of Housing and Urban Development's Multifamily Housing Resource Bank at HUD.gov. The Resource Bank has a number of excellent resources, including HUD's Changes in the Air document that Tara mentioned earlier, as well as supporting research, archived implementation webinars, web-based resources, and sample implementation tools. HUD also has a toolkit for both owners and managers, as well as residents of public housing who are interested to make their properties smoke-free. These toolkits can also be accessed via HUD's Smoke-Free Multifamily Resource Bank. As I mentioned earlier, I strongly encourage all listeners interested in this topic to connect with their local smoke-free housing program. You are certainly not alone, and there is no need to reinvent the wheel. There are hundreds of excellent smoke-free housing programs throughout the country available to provide consultations, advice, and implementation tools. At Live Smoke Free, we manage a global directory of smoke-free housing programs, which can be accessed through the link shown. I encourage you to visit both the HUD Resource Bank and your local smoke-free housing program to help you get started on your smoke-free path. Thanks so much for the time, and I also welcome questions at my contact information listed on the slide. And now I will pass the ball to Michael Freiberg.
Thanks, Kara. I appreciate it. Once again, I'm Mike Freiberg, and I'm a staff attorney with the Tobacco Control Legal Consortium and the Public Health Law Center. I'm going to show you how to submit comments to a federal agency, which is really a pretty straightforward process. I will then give you some additional details on what kind of information may be helpful to HUD in preserving and strengthening this rule. First, though, I want to give you a sense of where the commenting process fits into the process of federal regulation in general, and then more specifically to this regulation. This proposed rule was published on November 17th. There is a 60-day timeline for submitting comments to this rule. The deadline to submit comments is currently January 19th, 2016. Federal agencies sometimes extend the comment period for 30 days, and it is possible, but not guaranteed, that that will happen in this case. The agency has to consider all of the public comments it receives. There's no legal deadline by which an agency has to act. In the case of some agencies, it can potentially take years before the agency takes any final action, such as submitting a final rule. I don't know that that will be the case with this rule, however. Next, the agency prepares a final rule, which has to get reviewed by the Office of Information and Regulatory Affairs. Assuming that review is okay, the agency publishes a final rule. In the tobacco control context, there's often litigation concerning agency regulations. I don't know whether or not that will be the case with this rule, but I thought it should be mentioned. Those are generally the steps in federal agency rulemaking. The one step in this process I'm going to spend most of my time talking about is the one inside the red circle. Public comment is an important part of any federal regulation. Having a strong record of comments not only can help strengthen a rule from a public health perspective, but it can help regulations withstand potential legal challenges. So how do you submit a comment? There's a central website, regulations.gov, that all federal agencies use to gather public comments. You can actually submit written comments by mail, but as you see from this quote, which is from the proposed HUD rule, federal agencies generally prefer electronic comments. It can be tricky to find the right open docket on regulations.gov, so we try to make it easy for people on the Public Health Law Center website. This is a screen grab from the public health portion of our public housing portion of our website, which is currently featured on our main website. It includes a link that will take you directly to the docket where you can comment on the HUD rule. This is a screen grab of the docket for the HUD rule. You can see the Comment Now button in the upper right. If you look in the lower right, you'll see that 180 comments had already been received when I took this screen grab a week or so ago. I checked again last night and there were 261 comments received, and you can read all of them if you want to. If you click the Comment Now button, it will take you to this web page. This is what the commenting form looks like, and as you can see, it's fairly straightforward. You can just type your comment in the box and click Submit. However, we often submit slightly more formal comments as a scanned PDF on our letterhead. If that is your preference, you can go here. You can prepare your comments in advance in a Word document or a PDF and then upload it by clicking on the button that the arrow is pointing to. And then you click on this button to continue. And it's really that easy to submit comments to a federal agency. But what should you include in your comments? There are 3 things to start with. First, the rule name, the docket number, and why you're interested in the rule. But what makes a comment good and useful for HUD? So first, some general rules about what type of information is useful to agencies. Any comment you submit should be well organized. It should explain which provisions you support or oppose, and it should explain any provisions you think should be changed. Agencies may actually like it if you go so far as to suggest specific language that they could use. And your statements and recommendations should be supported by data, whether it's peer-reviewed data or just based on your personal experience. And now for information specific to HUD's proposed rule on smoke-free public housing, some of the things you could talk about include success stories and challenges you faced if you're with a public housing authority that's gone smoke-free. You could include information about how smoking in public housing contributes to health disparities. As we've talked about, the proposed rule excludes e-cigarettes and hookah, so those are definitely important topics if you feel that those should be covered. But Tara mentioned the 9 specific questions that HUD was looking for answers to, so let's get into a bit more detail about those. The questions to which HUD is looking for answers ask quite relevant public health questions, and I'll show the 9 questions shortly. However, it's important to note that HUD prefaced the 9 questions by noting that they do in fact welcome comments on all aspects of the proposed rule. So if there's something you think is important to comment on, but it doesn't fit into the 9 questions, you should go ahead and comment on that issue anyway. With that being said, here are the 9 questions. The first question asks for examples of costs or burdens smoke-free policies might impose on public health authorities. I'd say if you think public housing authorities won't incur particularly high costs, that would also be important to mention. And this is a question where personal experiences and stories might be particularly important. The second question asks whether the rule adequately addresses issues posed by secondhand smoke. If you think the exclusion for water pipes and e-cigarettes harms people by exposing them to secondhand smoke, this is a relevant question to answer, although we'll see questions about those specific topics later. You may also want to talk here about some specific locations if you don't think they're adequately protected. These could include outdoor areas like playgrounds, or it could reference the 25-foot distance in the buffer zone, or it could reference the exclusion of Section 8 and mixed finance properties. The third question deals with effects on groups of individuals, such as families, children, or people with disabilities. It asks if there are burdens or benefits to these groups, particularly if they're evicted, which seems a little bit leading, but that is in the question. This is a question that's directly relevant to the issue of health disparities. Both data and personal experiences would be very relevant here. The fourth question is directed toward public housing authorities that have already implemented a smoke-free policy, wondering what sorts of exceptions have been granted. This also relates to your personal experience. One type of exception that might be relevant here is for people with disabilities. Secondhand smoke is harmful to bystanders whether the person smoking is disabled or not, and there's no legal need to exempt people with disabilities. So if you work for a public housing authority that has implemented a smoke-free policy but exempted smokers with disabilities and it's caused problems for other residents, HUD would want to know about that. Conversely, if you work for a public housing authority that has implemented a smoke-free policy but not exempted smokers with disabilities and it's worked well, ideally the smokers will have quit smoking, HUD would certainly want to know about that as well. The fifth question is also directed toward public housing authorities that have implemented smoke-free policies, but it's a bit more open-ended. It's just asking for experiences, lessons, and advice. The sixth question is directed at smoke-free public housing authorities, but it's asking about what sort of cessation services have been offered. This is the only question dealing with cessation, so if you have thoughts about the best way to provide cessation but you don't represent a public housing authority, you should still consider commenting on this topic. The seventh question asks what kind of support HUD can provide. This support can relate to many things: training, messaging, signage, and other resources. The eighth question asks if e-cigarettes should be added to the rule. There are lots of things you can talk about to answer this question related to e-cigarettes, from health concerns to enforcement challenges if e-cigarettes are exempted to the renormalization of tobacco use. And a lot of these questions are relevant to the ninth question as well, which asks if water pipes or hookahs or shishas, whichever they're called, should be added to the rule. And it asks whether it increases the risk of fire or property damage to exempt these products. Again, like e-cigarettes, you can talk about health concerns for hookahs or fire risk or property damage and so on. And that's the last question that HUD requested answers for. I'd reiterate that if you want to comment on a topic that isn't reflected in these questions, you should still do so if it is relevant to the issue of smoking in public housing. I mentioned that 260 comments have already been submitted. I've skimmed through most of those, and some of them do a better job of addressing the issues related than others. I thought it would be helpful to show you a few examples of comments that have already been submitted. Now, this is an anonymous comment, and I wanted to show it partly just to show that even though it says on the submission form that your name is required, they will still receive and post anonymous comments. Now, the person who wrote in here has asthma and supports the rule. I don't know whether or not the person reviewed the 9 questions that HUD was looking for answers to, but they did mention that they are allergic to hookah smoke, among other types of smoke. So this comment is relevant to question number 9, which asks whether hookah should be exempted. Now, some comments are more formal than this one. Here's a comment submitted by a legislator from Hawaii. He writes in support of the rule and mentions his experience from Hawaii. He introduced a bill prohibiting smoking in public housing projects. It's a pretty short and to-the-point letter, and it helps bring home the point that many jurisdictions have already adopted similar policies without much trouble. Some comments are longer than this one. Here's one submitted by Jim Repace, who some of you on this webinar may have worked with. He's a scientist who studies the effects of secondhand smoke in various settings, one of which is multi-unit housing. His comment was 14 pages long, and it included numerous citations. I've just pasted his conclusions here from a screen grab. He mentions the health hazard posed by secondhand smoke and notes how it can infiltrate from one apartment to another, so he's clearly in support of the rule. Similarly, the Board of Health from Johnson County, Iowa, submitted a 3-page comment in support of the rule. However, the board asked for it to be strengthened in 3 ways, and I've pasted the 3 recommendations here from their conclusion section. They want the rule expanded to all types of housing involving public financing. That would bring in Section 8 housing and mixed-use projects. And they want e-cigarettes and hookahs added to the rule. Of course, not all of the comments that have been submitted are supportive of the rule, so I thought I should show one example of a non-supportive comment. So here's an example from a housing authority in Texas raising some concerns with the 25-foot setback provision. And there were a couple along these lines, so if you work for a housing authority that has a setback provision and enforcement of the setback provision has gone smoothly, that would be an important thing to mention in any comment to HUD. Now, other concerns that some opponents of the rule have raised involve liberty concerns. So those are just some examples of the comments that have already been submitted. Now, we here at the Public Health Law Center and the Tobacco Control Legal Consortium hope to make it as easy as possible for you to submit a comment, and we have several resources on our website. So this is a screen grab from our website. Now, I already mentioned that we have a link to where you can comment, as well as a summary of the rule on our website. This webinar should also be archived there very shortly. One thing that should be ready also is a template comment along with talking points to help with people who want to submit comments. We hope to have that there within a week or 2. The administrative rulemaking process, particularly at the federal level, can seem daunting if you're not used to it, but it really is fairly straightforward, and there are lots of groups out there that want to make it as easy as possible for you to submit comments so that a strong public health position will be recognized by HUD. So I hope you'll take advantage of these resources, and that's pretty much what I have to say, and there is my contact information. So with that, I'm going to turn it back to Darlene, who's moderating this webinar.
Thanks, Mike, and thank you, Kara and Tara, for your presentations and lots of helpful information. And as always, we welcome your questions both now for our presenters and later if you think of something afterwards. So we have a number of questions that have come in, but if you haven't had a chance to type your question, please feel free to do that now in the Q&A panel on your screen. For any lawyers that might be listening in, we also wanted to mention there was a question beforehand about whether CLE credit, continuing legal education credit, would be available. We did apply for 1 hour of CLE credit here in Minnesota, so if you need more information about that, please feel free to contact us here at this contact information. Again, if you haven't had a chance to type in your question, please do that in the Q&A screen on your panel. If we're not able to get to your question, please feel free to contact us afterwards as well at this contact information on your screen. So I'm going to start with a few questions for Tara at HUD that ask for clarification about the rule. Tara, can you clarify whether the rule would affect tribal housing authorities?
It would not, no. This is just public housing managed by public housing authorities, set up under, I think, the National Housing Act.
Okay, so related to that question, would the rule apply to Section 8 properties? And a lot of this may have been covered in the, your presentation. I'm just wanting to reiterate for folks who may have joined in late.
Sure, thanks. No, that, so Section 8, we have tenant-based Section 8 and project-based Section 8. Tenant-based, it's also called our Housing Choice Voucher Program, would not be covered. And project-based Section 8, which is managed by HUD's Office of Housing or Multifamily Housing, would not be covered. These are just public housing units managed by public housing authorities.
Okay, so when you say public housing units, will the policy apply to all types of public housing units, like freestanding homes or multi-unit structures?
Yes, so we have, they're sometimes called our scattered sites, so we can have single-family dwellings that are covered. Because they are public housing, they would be covered. And I think I forgot to mention earlier that it also covers attached balconies and porches.
Great, thank you. Does the rule, or would the rule apply to mixed finance development properties?
So technically no, and we had another question I saw about what do we mean by mixed finance. So we have housing authorities that that manage properties where they're not the sole owner and they perhaps have tax credits or project-based vouchers mixed in, and there might be you know, public housing unit within that structure, and it could be a multi-unit building, of course. And those units would not be covered. And the reason they are not covered is that we didn't want to have the situation where smoking is banned in just 1 or 2 units within the building, but not the rest of the building. That would present, you know, challenges for those residents, but also, you know, be perceived as unfair potentially. If we were to cover those types of structures, it would be a separate rulemaking under other authorities.
Okay, great. Thanks for answering a number of questions that came in around that topic. So you've made clear, Tara, that the rule does not include e-cigarettes currently. Can you talk about at all why e-cigarettes were not included in the proposed rule?
Sure. So when we started this rulemaking, believe it or not, it was over a year ago, and when we first started, we were a little unsure of what research supported the health risks. Now, of course, that has become apparent that there are health risks to non-smokers or people who are not using e-cigarettes. But again, we didn't have the same compelling research supporting damage to property and the fire risk. So when I say damage to property, what I mean is that we knew that when our housing authorities are turning over units, we estimated the costs, I think, between $16 and $38 million annually for all our housing authorities to turn over a unit that a person that smokes has lived in. We didn't see that same level of damage in units where a person had been using e-cigarettes. Again, that being said, we encourage our housing authorities to include those. And I should say, if more information comes in related to the supporting e-cigarettes and hookah pipes within the rule, we could include them in the final rule. The way we wrote the proposed rule was to leave it open, and again, we're looking at comment on that. And I should say, we had a question about how do we define lit tobacco products, and if there was a change at the state level to include hookah pipes or e-cigarettes and tobacco products. We specifically tried to write the rule to be as narrow as possible, where the tobacco is actually being lit and not other things like, I think in hookah pipes, the charcoal is maybe lit. I'm not an expert, but it's really just where the tobacco leaves themselves are being burned. And again, that's where we saw the greatest damage to the units and the greatest fire damage risk.
Thanks, Tara. Another question seeking clarification about the rule was whether the rule would propose restricting smoking on the exterior outside grounds of public housing. Oh, yes, and I saw some type questions on that too. So it's 25 feet from the building. So if it's a housing complex or property, or it could even be the administrative building on the grounds of the housing authority development or their campus, it would be 25 feet from the structure. Now, the 25-foot buffer rule, it was supported by research that I think and again, I'm not the expert here, I'm a housing person primarily, but that the smoke can travel at least up to 25 feet. So first we knew that housing authorities that have a buffer zone, they have fewer complaints from residents where, the smoke is coming in their window. So if you have smoke coming in your window or getting into your unit, you may not know if that's somebody immediately outside or if it's your neighbor, across the hallway. So the 25-foot buffer could help reduce some of the tenant complaints around smoking violations. But we also know that we have some of our public housing projects that are, developments that are maybe right on the street, and 25 feet for those buildings may mean we have residents being essentially forced across the street to go smoke. And if that's presenting a challenge for housing authorities, we would like to know about that. What we've also said about the 25-foot buffer is that we're encouraging housing authorities, if you have benches outside of that 25 feet buffer, that could help encourage resident compliance. There's some buildings, if the bench is right outside, you probably are going to have residents sit in that bench and smoke right in front of your building, and that's just going to cause more problems than it solves. So we encourage that there are designated areas for smoking with seating. Other housing authorities have gone so far as to put up gazebos or, shelter for smokers. But it's not required in our rule. It's encouraged, but not required. Okay. Thanks, Tara. While we're on this topic of sort of outdoor areas and the buffer zone, I'm going to transition to some of the questions. So Mike, can you talk a little bit about the setback provision of 25 feet? Does that mean that a housing authority could make the setback zone less than 25 feet?
Thanks, Darlene. No, it doesn't. Just looking at the text of the rule itself, it says that the smoke-free policy has to apply to outdoor areas within 25 feet from public housing and administrative office buildings. So that means all areas within that 25-foot buffer zone have to be smoke-free. So, that I saw the question come in. It doesn't mean that a public housing authority could make the setback provision less. It has to be at least 25 feet.
Okay. Also related to outdoor areas, Tara at HUD or Mike, can you address whether playground areas would be covered by the rule?
I think if I remember correctly, the rule says that the housing authority would need to make a local decision to exclude smoking from those areas.
Yeah,
we just did the 25-foot buffer.
Yeah, it says they may accommodate outdoor areas or public housing authorities may choose to create additional smoke-free areas outside the restricted areas or to make their entire grounds smoke-free. So they do have that authority.
Okay. And so that guidance that you just provided and read from the rule, Mike, does the rule supersede policies that have already been passed by housing authorities, or will housing authorities have the ability to pass or keep stricter policies?
As long as the policies are stricter than the proposed rule, assuming the final rule uses the same language as the proposed rule, they do have the authority to adopt stricter policies, such as by making the entire ground smoke-free, but they they can't, if an existing rule is in place that's weaker in some regard than the proposed rule, so say for example it is a 10-foot setback instead of a 25-foot setback, then it would have to, within 18 months of the effective date of the final rule, it would have to adopt a rule to be in compliance with the 25-foot setback provision.
Okay, great. I think that covers most of the sort of outdoor area type questions that we got, and there's still a few more questions clarifying about what's covered in the rule. A question was asked about what constitutes a lit tobacco product, and I know, Tara, you talked about that a little bit. Mike, can you clarify for folks what constitutes a lit tobacco product? Would that include marijuana smoke, or smoking marijuana, or medical marijuana, or any incense, for example?
Sure. The definition reads, lit tobacco products includes all lit tobacco products that involve the ignition and burning of tobacco leaves, such as cigarettes, cigars, and pipes. So specifically, the rule excludes electronic cigarettes and hookah pipes, as we've talked about. I did see the question come in about incense. That's that's not a tobacco product, so that would not be included. The same applies with marijuana. That is not under this rule. That does not meet the definition of lit tobacco products. I know HUD has issued, and maybe Tara can talk about this separately, but I know HUD has issued a separate memo. I don't think it's went through the formal rulemaking process about the issue of using marijuana, because it is still a federally prohibited substance. I don't know if you have anything to add on that, Tara.
Sure, not a lot, because our guidance on that, it really just clarified the existing federal laws, the way that marijuana, I think, is scheduled. So this rule has no impact or change on the existing provisions. Again, I'm not an expert, but I think it's that it's users. If you are a user, you're prohibited from entry into public housing or Section 8. But really, there's some local discretion about residents that are maybe currently using medical marijuana where it's allowed. This is an area where HUD has written its policy, but we do not meddle in the details. And okay. That policy, actually I should say, there is a questions and answers document that is going to hit a lot of these questions that have come in, and we have a link to that policy on our website. The Q&A is posted if you go to HUD.gov and you go to the Public and Indian Housing Program Office page. The rule and this Q&A are posted there, and I can get that link out to folks after this call.
Great, thanks, Tara. One more question has come in right now while we're on the topic of lit tobacco products. Would lit tobacco include the traditional tobacco used for ceremonial purposes? Mike, do you want to take a stab at that one?
Well, sure. Again, I would just go back to the definition that's in the proposed rule here. It does say the products that involve the ignition and burning of tobacco leaves, such as cigarettes, cigars, and pipes. I know several tribes that use native plants such as red willow and sage. I don't know whether or not those would meet the definition of tobacco leaves. I think that would be a reasonable one to use the commenting process to request further clarification from HUD, or if whoever asked the question has thoughts about whether it should be excluded or should be included, to use the commenting process to express those views too. And Tara, I don't know if you have, or Tara, if you have anything to add on that one.
Sure. No, you're correct that sage or other products that are burned would not be covered under the federal requirements. There could be local policies prohibiting that. When we wrote this, we didn't realize there was burning of tobacco leaves for ceremonial purposes. So, yes, please, if there's information about that, please send that in on comments in the comment period. There was also a question about maybe this is about hookah pipes, that the tobacco can be put on top of the charcoal and then it's combusted there. We didn't have all of that information when writing the proposed rule, so if that is indeed what's happening and that the tobacco leaves are being burned, then yes, please send us that information.
All right, so we also have a number of questions that have come in around implementation and enforcement, and we're going to get Kara involved in here really soon. So but before I do that, I want to pose some of the messaging and legal questions that have come in. Mike, can you address, is it discriminatory to prohibit smoking in multi-unit housing?
The short answer is no. I mean, I assume by discriminatory, and I'm using discriminatory in kind of a legal sense here, just like does it violate some sort of constitutional protection, or is it against the Americans with Disabilities Act? People may have their own personal thoughts about whether or not, such a policy is discriminatory, but legally I would say it's not. There have been a couple of different decisions handed down in federal district courts, as well as state courts holding that, basically smoking or addiction to nicotine is not a protected class. There's no right to smoke. You don't have to allow people to be able to smoke. There was a law review on this topic that noted that smoking behavior can change frequently, whereas most anti-discrimination laws are intended to protect immutable characteristics. So, the fact that people start, millions of people start and stop smoking every day suggests that they don't fall under the purview of these anti-discrimination laws.
Okay, so Mike, you mentioned the ADA, Americans with Disabilities Act. Some questions have come in about if someone with a disability, either mentally or physically, is impacted by the rule and can't go outside to smoke, how would this affect them? How would the rule impact them?
Well, again, there's no legal requirement that these people be exempted or provided some sort of reasonable accommodation, at the risk of sounding harsh there. I mean, it is a fact that other residents are harmed by infiltrating secondhand smoke, whether the smoker is disabled or not. I would say that with this population, it's disabled individuals who are smokers, it's extra important to link them to cessation services as part of the implementation of any smoke-free public housing policy.
And Tara, did you want to add something?
Yes, this is an area, again, we're collecting information on how our housing authorities have managed this with their residents. We've heard instances of, if they were a resident was physically disabled, they perhaps moved that resident to the first floor so that it was easier to get outside. It's my understanding of the reasonable accommodations process that, you're not accommodating the smoking behavior. And so you wouldn't want to select, for example, the option, you wouldn't accommodate a resident to continue smoking in their unit because that would be a violation of our regulations. You wouldn't be allowed to do that once the rule is final. Because this is such an area of misunderstanding and we know we need to get some more information out there from the experts, we're going to develop a guidance on this after the proposed rule closes and we see what comments come in, and we'll work with our experts in the Office of Fair Housing and Equal Opportunity. We've got attorneys that know the requirements backwards and forwards for reasonable accommodations, and we'll get some guidance out on that.
All right, great. And Kara from Live Smoke Free, so we're talking right now sort of about some of the vulnerable populations that live in public housing and how the rule might impact them. There was a question that came in about how the claim that this rule will negatively impact low-income tenants and other types of vulnerable populations. How can that claim be addressed?
Great question, and I guess I emphasize how important messaging is both to residents and to management. Something that I like to think about when I hear that is, say a kid lives in public housing, a smoker can go outside to smoke, but that child cannot sleep outside if they're being exposed to secondhand smoke 24/7. So I think to really think about who lives in the building, what is the population, what talking points might be effective for that population, and to really focus on those talking points of health, not only health equity, but social justice as well. So we know in the United States that more and more significant portions of market rate housing is going smoke-free, so non-subsidized housing. And where we're seeing the housing remaining that isn't smoke-free is largely in that subsidized and public housing arenas. So as I mentioned earlier, we believe strongly that everyone deserves to have a healthy, safe, and clean place to live, especially those that may not be able to necessarily choose where they live.
All right, very helpful information. So I want to get into some of the questions about implementation and enforcement, and I think what I'll do is I'll start with sort of a general question, Kara, at Live Smoke Free. Is it hard to enforce smoke-free policies in multi-unit housing?
Great question, and I go back to what Tara was saying earlier. Implementation and good preparation is really key for both a smooth policy transition and implementation process. That being said, change can be hard, and we don't minimize that fact. But that being said, it's really important to make sure that everyone in the property is knowledgeable and prepared for the policy. I highly recommend people check out the Changes in the Air action guide that both Tara and myself mentioned. There are excellent sample enforcement strategies listed within there from other public housing authorities throughout the United States. There was another question that was posted about what have other public housing authorities that have gone smoke-free done. I'd say I've seen pretty much the whole spectrum from kind of a 3 strikes and you're out policy strategy to more typically a graduated, it might be a 7 or 8, strikes, if you will, before eviction is even considered. And a lot of times that more graduated eviction policy will include supports to cessation, referrals to social services to address what might be prohibiting the person from abiding by the policy. So I'd say it's really important to, again, look at the population. I always emphasize that managers know the people who live in their properties best. If possible, make that policy enforcement the same as any other policy on the property, just for consistency's sake. But if not, again, our goal is to keep people in housing. We want to make sure it's clean and healthy housing. So an enforcement strategy works really well from what I understand and from what I've been told. It's really up to the manager as far as what that enforcement looks like, but a graduated enforcement really works the best.
Great, Tara. You also actually sort of just addressed another question that came in about can those who will not stop smoking still live in their homes? And I'm wondering if you can sort of repeat what you've just talked about around that issue, that question.
Yeah, I think for those that are going to have a real difficult time stopping smoking, a couple points. Again, provide ample notice. Again, change can be hard, especially if we're talking about residents with severe and persistent mental illness or other kind of confounding factors. 2, I would include social service providers are going to be key. The social workers, caretakers, the ones that are interacting with residents on a daily basis are going to be really, really important to helping make this policy successful and also providing support to those residents that may be hit hardest by the policy. And 3rd, I'd strongly encourage people, management to bring in perhaps local public health or the American Lung Association to talk about what are some strategies that residents can use if it's 2 in the morning and it's cold outside and they don't or can't get outside to smoke. What are perhaps some FDA-approved options for getting nicotine without the smoke? So there are some strategies as well that can be provided to residents. And a resident meeting after the policy has gone into effect can be really helpful for residents to ask those kind of questions.
Okay. So you've mentioned how important preparation and sort of consistent enforcement is. Do you know how enforcement is going for local public housing authorities that have enacted smoke-free policies?
I would say that, again, good preparation is key. I'd say typically on day 1 it's not going to be 100% perfect, just speaking in all reality. And it really is a process. What we've seen and what a lot of data has shown both here in Minnesota and nationally is that after smoke-free policies have been implemented, there is significant secondhand smoke reduction 6 months after the policy, even more 12 months after the policy. But it is a process, and like all policies, there are going to be residents that try and push the envelope and may try and see if they can get away with it. But remaining consistent with enforcement and education and involving all staff, not just on day 2 of the policy, but 6 months after the policy, 12 months after the policy, 18 months is going to be really helpful. And again, I encourage listeners to contact their local either public health department or smoke-free housing program to help them with that process and help provide strategies that can help not only with enforcement, but to promote compliance as well.
Thanks, Kara. I think what we'll do now is, Kara, do you know of any of the 600 public housing authority policies? Do they address e-cigarettes or hookah at all?
Yeah.
And Tara, maybe you can jump into if you know.
Yes, I can say there are a handful in Minnesota that do. I would say it's, from my experience, less common, but it is included.
And on the HUD side, no, we don't have that information.
Okay. And some more specific enforcement questions that have come in that either Tara or Kara you could address. Will residents be referred to cessation services such as the QUIT line, 1-800-QUIT line, through the rule?
This is Tara. I hope so. It's not a requirement in the regulations that the housing authorities refer residents or offer or provide cessation support to the residents. It's certainly something we are highly encouraging and will continue to encourage. And then in the background, we are working with CDC, EPA, and our federal partners to line up those resources so that we can make sure they're available. And then in our partnership, we can get that information out to our housing authorities. We also will be doing more technical assistance, and we'll emphasize that as well, because again, as Kara said, we know the better you do implementation, the less enforcement you have to do. And that's our hope, that there is better implementation, that we get the message out that you don't have to quit smoking. It might make compliance easier. You don't have to quit smoking, stop smoking. Our housing authorities can continue to rent to smokers. It shouldn't be something that you ask at intake, but that there's help where we are essentially, closing a door, we're opening a window, that hopefully there is support for the residents.
Okay. There are some folks who are asking whether, so how will the new rule be enforced? Who will be doing the enforcement?
So first I want to mention that this is just still a proposed rule, and then, after it's finalized, it wouldn't be effective if that portion of the proposed rule stays as it is. It would not actually be effective for 18 months. So first, a lot of that enforcement is going to be at the discretion of the housing authority. It would be outlined in their smoke-free policy. Beyond that, though, HUD does have an obligation to ensure that our housing authorities are complying with our regulations. So it would be through, we have 43 field offices, and then staff in these field offices that have an assigned portfolio of agencies. And while we haven't, defined all the details here at HUD yet, it would likely just be part of our ongoing monitoring and follow-up. We already see when housing authorities are working on plans or they submit them to HUD for review, we will check through the PHA plan submission process. A lot of this is just through the regular processes HUD already has in place.
Okay, Kara, so you mentioned the 18-month implementation period. Would all the residents of public housing authorities be required to sign the new policy by the end of the 18-month period, or can there be a phase-in process to complete that after the 18 months?
The entire property must be smoke-free at the end of that 18 months. So they could be, say if their lease comes up before the 18-month period, they could have their lease amended at their renewal that they can no longer smoke in that particular unit. There might be, this is again where we allow discretion to the housing authorities. Some housing authorities have a big lease re-signing event, and they would add the smoke-free rider on at that point, or they could, again, do it at the regular renewals, as long as everybody is covered at the end of the 18-month period. We also have a provision in there for housing authorities to start within 60 days of the final rule. So technically a housing authority couldn't wait until month 17 to do all of this and get it done, because we know that the resident engagement and the planning process and communication can't be done that quickly. So they need to start within 60 days of the effective date, final date of the final rule.
Okay, and some questions also came in about funding, whether there would be any funding provided by HUD to support enforcement and do education with providers to work with tenants on cessation, or any funding to support legal complaints by those who currently live in HUD housing.
The rule as developed does not include funding. You know, I can't speak to future appropriations. If this is an area that Congress feels HUD should provide some funding for, it could be in future appropriations, but as it stands now, we do not have any funds for implementation or enforcement. There are some limited funds that can be put towards technical assistance and outreach. And again, through this, we're still trying to get a sense of what are these costs going to be, because we didn't quite have that when we wrote this rule, so that information is really useful in the comment period.
Okay, Kara at Live Smoke Free, maybe you can at this point talk about some of the resources that are available to help folks with implementation and enforcement. Are there best practices enforcement types of guides? I know you've mentioned working with smoke-free housing programs and local health departments. Can you mention some of those again?
Sure. I think the first place to start is the HUD.gov. The Multifamily Smoke-Free Housing Resource Bank is a really excellent kind of collection of resources available. As has been mentioned a couple of times, the changes in the air, the action guide, is also really, really helpful and includes a lot of sample tools and resources available for folks. A few resources that we have here at Live Smoke Free. We do, if you are a smoke-free housing advocate or tobacco control professional, we do have a manual specifically for how to assist housing go smoke-free. So I encourage folks to check out our website at mnsmokefreehousing.org, and we have a number of sample resources up there as well. I know both the Public Health Law Center and Tobacco Control Legal Consortium have a lot of really excellent resources, as was earlier mentioned, so I encourage you to check out their website as well. Most specifically, please check out that global directory to find who's working on smoke-free housing in your area. As I mentioned, there are hundreds of excellent smoke-free housing programs with many of the same resources that I mentioned that may be tailored to the specific community that you're working in. So I encourage you to check out the global directory and connect with any smoke-free housing programs in your area.
All right, so there's one more question that came in, Tara, from HUD about the 18-month implementation period. When does the 18 months start? Is it after both the final rule and the reasonable accommodation guidance that comes out from HUD, or when does the 18 months start?
The 18 months starts when the rule is final. The reasonable accommodation ADA guidance, that doesn't, ideally we might have that done before the final rule. Again, it's based on the comments, so just knowing how long it takes to get a final rule out of all the various government buildings, the guidance hopefully will be sooner than that. And then the 18 months, the clock starts ticking once the rule is final.
Okay, great. And one more question related to sort of commenting, submitting comments. A question was submitted earlier about what types of language someone might recommend to HUD to define smoking comprehensively. Maybe, Mike, you can take this one?
Well, sure. I mean, if it sounds like the goal of the person who asked the question is to have smoking defined as comprehensively as possible. So, you know, one thing we might suggest to a group, you know, or like a government working to strengthen their smoke-free law that way, or, you know, would be to define smoking to include products that are both lighted or heated. You know, the HUD rule right now just uses the phrase lit tobacco products, so to me that suggests only lighted products, and it wouldn't capture things like electronic cigarettes, which are heated. And also to include tobacco or plant products. You know, there are, you know, if you want, there are products at least advertised to be used in hookahs and water pipes that are herbal, you know, non-tobacco products. So even if the rule as it is written now is expanded to include hookahs, it still refers to tobacco products. So if there's any non-tobacco product that's smoked in a hookah pipe, it would probably not be included. And then that would also cover marijuana if it's expanded to include any sort of planned product. It would make it clear that that's included in there.
Okay. I think we sort of covered most of the big questions. One final sort of question, maybe Tara and Kara, you could address. Beyond submitting comments, how can organizations who serve clients that will be most affected by the rule work with HUD to ensure those vulnerable and in need of cessation support are accounted for and provided the support they need? Tara, HUD, do you want to take a first stab at that?
HUD ensure that those that, oh, hi, it's Tara, sorry. If I can understand the question, it was how do we ensure that those that need extra assistance receive it?
Yeah, so beyond submitting comments about, you know, providing those types of supports, are there ways that organizations can work with HUD to get that support out to the residents?
In terms of working with HUD, we connect to other resources. It's kind of outside of our scope. For supportive services, it's definitely something, you know, a lot of housing authorities know better than we do who their local resources are. Definitely look at Kara's, the link that she provided, and then on HUD.gov/healthyhomes, we have other resources and links to other organizations. It's my understanding the American Lung Association has a lot of local chapters, and EPA is very interested in helping as well. EPA has a lot of community-based asthma programs. There could potentially be support services there. But you have, that is an area that we know we HUD are weak on, and we are aware of a lot of resources in the community and a lot of federal agencies that are working in this space, and I can assure you we are trying to work with them to get that information out. They do it better than we do, and they fund these organizations, but on the HUD side, not as much, but definitely from our HHS partners, CDC, through the national quit lines and the state quit lines, we are optimistic that support will be there, but again, we solicit feedback on that, especially, you know, one area that could potentially be weak for HUD is where we have very small housing authorities in rural areas and what kind of support services might be available for residents there. We hope the answer is the local health department, but we just don't have all that information yet.
Tara,
I'll just,
yeah.
I'm sorry, I'll just add one thing. I 100% agree with everything Tara just mentioned, and I would add the more housing authority can use either staff or social service agencies or local public health who are already working inside of the buildings or working with residents, the better. A lot of times we've found that if residents have already built up a relationship or trust with specific people, utilize those people who are already on the ground to be not only your eyes and ears for policy enforcement, but also from a support perspective and an education perspective for residents, because they're the ones that are going to have the most respect and trust from the residents already.
All right, great. Again, if we inadvertently missed your question, please feel free to contact us at the information on your screen. And I think at this point, we will go ahead and end the webinar. Thank you again to Tara and Kara and Mike for your great presentations, and good luck to everyone with the commenting process.
Thanks, Darlene, Kara, and Mike.